Good evening, everyone, and welcome to the work session of the Mayor and Council of the Town of Berlin for Monday, April 18th, 2022. This evening, our work sessions to discuss the enterprise fund or the utility funds. Before we get into that discussion, we do have not Chris Carroll as our agenda identifies, but Zach, go ahead and introduce yourself to the group.
Good evening, everyone. My name is Zach Hall. I'm with One Digital. Happy to be here tonight to go through our medical renewal benefits for the Town of Berlin Employee Benefits Program. Here to answer any questions anyone has. Just go through everything together.
Thank you. And we also have our administrative manager, Kelsey Jensen, who's been running pretty much point on our renewal here for our health care for all of our employees. So thank you.
So we will go ahead and get started. As we mentioned, Chris Carroll could not be here tonight, but he is available by phone. He said if needed. He also can be reached, via email if we had any follow-up questions. So we'll go ahead and get started, and if we need him, we'll get him on. So,
thank you.
All right. So some of the plans we're going to discuss tonight. CareFirst is our current carrier, and that will be who we are recommending. We did not receive, they either declined or they weren't competitive, meaning that they're over our current carrier at Benefit Indemnity, All Savers, Aetna, Cigna, and then we are going to recommend as option 2, United Healthcare. And then we'll get into some of the specifics on the local government insurance trust plan, which is using the platform of Benecon, but they're actually Cigna is their insurance. So we'll get into that a little bit. I'll skip over that part right now. Once we get to that slide, I'll get into more details. So when CareFirst very first came back, they came back at a 12.97. So that was obviously quite a jump there. But when Chris worked his magic and his team over there, we basically were able to get it down with loyalty credits and factoring in the HRA utilization down to a 3.71% renewal. So that comes out to an annual increase of $39,878. And then I told Zach he can jump in if I'm missing anything or if you guys have any questions. But we're going to recommend this plan. We usually budget at a 60% utilization on our HRA, but we feel comfortable changing that utilization to a 52% based on our last probably 5 or 10 years. Chris has gone back and looked, and we're not really hitting that 60% mark, so he said he felt comfortable changing that down to a 52% utilization. So this does reflect that 52% utilization.
Thank you, just for a moment, as we go through, just update us on the page numbers.
Oh, I'm sorry. We're on page 7.
So we're on page 7.
Yep.
So can I jump in real quick?
Yes.
So everybody understands and Zach, you stopped me where I get off track, but when you deal with insurance, the key word with insurance is risk.
Yes.
So the way things, the process, the system that we're using for like Dean remembers, Troy remembers, because you both are on our health insurance. When we go back 12 years ago, we did not have this HRA set up. So we started the HRA set up when the rates started to go through the roof. The HRA is not a health savings account. It's an employer-based money, if you will, that goes toward the deductible and some of the out-of-pocket expenses. So when you think about risk for a second, the way our system is currently set up and what's going to be proposed tonight throws a slight change on one plan just a little bit. But you have the biggest majority of the risk that's being absorbed by the carrier. So this year, using this year's what we're doing, CareFirst absorbs most of the risk. Then we get to a point that you've got that HRA account that is part of the risk as well. And then you've got for the all groups but the employee only, you've got that $1,000 donut hole that we've grown accustomed to. That's risk. And then this year we're talking about doing, for one of the plans for the Delaware folks, doing a very slight co-insurance risk. So again, spreading that risk. The question that's come up over the years that I recall with that $1,000 donut hole, will it boil down to will we ever have an employee that has to make a decision to pull $500 out of their pocket versus getting health care. The reality is, yes, there's a possibility that could happen. However, I don't have the numbers in front of me, but we have gone from having a handful of folks that participate with a flex savings account to, double digits now.
There's 19 employees currently that have a flex
And
savings.
so we've gone to a third of our employees now that have flex accounts. And that, again, helps them out. And we've done this in the past. I'm going to pick on John Doe. John Doe has a $1,000 donut hole. John Doe runs into a situation where he's at that $1,000 donut hole. He doesn't have $1,000. What have we done in the past? And it's happened in 10 years, maybe 3-4 times, where we'll sit the employee down and say, okay, you need $800, you didn't elect it before we started the year, so what we do, so the employee doesn't have to choose between healthcare or eating, we then will do a payroll deduct to account for that money, so that they're not in the hole. They don't have to make, I don't want an employee worried to death. They should have done it to begin with, but they didn't. But I just don't think it's the right thing to do to an employee and say, sorry, Charlie, you're on your own. We've done that. But my message to you is, with the risk, it's spread out. It helps immensely with the rate. And again, the way that money works, it's promised money, but it's not committed money. So our utilization over the last number of years has actually gone down from the 60% that we're hovering, in the low 50s. So that's a good thing. That could change on a dime. It could change on a dime. So the other interesting twist that I share, when I think back 4 months ago when we were thinking about insurance rates for FY23, everyone at this dais had the same concern, I guarantee you. COVID. So everyone, me included, had that impression in our heads that insurance rates were going to probably go through the roof, which we expected. But the reality on something that we never thought about, I do now because it makes sense, during COVID, you started having telehealth versus going in person, less cost. Folks didn't go to the doctor for whatever the reason, because the hospital said you couldn't, we couldn't do this elective procedure it was done, so things were put off. So the COVID pandemic actually, in my opinion, helped keep the rates down for FY23. Fair statement?
Absolutely, yeah, and migrating towards, where we're going for care, where we're seeking our care, the old standby was, if you're not feeling well, you go to the emergency room. Well, emergency rooms are very expensive, to Mr. Fleetwood's point. So nowadays, through COVID, people are more comfortable utilizing services like telemedicine, or maybe even going to the urgent care center. We've all gone to the urgent care center a million times over the last 2 years now, get tests and things like that. So people are now seeking these alternatives to just running to the emergency room for every little thing, which is keeping our costs down. Where we start to see that at the employer level is that I have $4,500 from the town that I can use towards my medical expenses. When I go to the emergency room, that's a $1,500 bill. When I go to telemedicine or to Your Doc's In, that's a $0 bill on the virtual side, and maybe a $75, $150 bill on the urgent care side. So absolutely, to Mr. Fleetwood's point, is that we have seen the migration of care move to those lower end, not lower end to discount them, but just the less expensive care centers, which is saving all of us money, the employees and the employers.
It's also
Now, don't get me
increased
wrong, no.
access.
Say again,
It's
sir.
also increased access to care.
Absolutely, yes. You can be seen through, telemedicine 24/7, 365. Urgent care center is not, the emergency room is not, but, open times when you're not able just to schedule that visit with your primary care physician, things like that. So, members are able to get care more often, more frequently, and it oftentimes at a higher level than they would have perhaps gotten at the emergency room historically.
So is telemed going to stay the norm?
Absolutely.
Yeah.
Absolutely, yeah. It's really not going anywhere, and if anything, it's actually being broadened these days. Market trends are showing that, and I don't know if it was necessarily COVID or just the way the world is going, but I think probably a combination of both is that a lot of the telemedicine benefits are now being extended even to things outside of just normal, cold, cough, flu, pink eye, but into the area of mental health is now having a big push towards telemental health or virtual mental health visits, because that's where care is also so important, where is a member was trying to, seek care with a therapist out of network or something like that, or didn't have one in their area, they're now able to utilize, the same CareFirst virtual visits for their mental health. And it's certainly not going anywhere. If anything, everybody's pushing members towards it, carriers, employers, all of it.
Yeah, I was just
Enhancing those
thinking,
benefits.
I've seen a lot of the push in the school systems for the telemental
Yeah.
health. I'm also curious, and I know I'm hoping you know, maybe you don't, but when it comes to like those elective guys, you know what I mean? You may have to do like that first office visit or whatever with those guys, but you know what I mean? Are they still encouraging in between?
How do you mean? So like, for example, if you're not an established patient with like a primary care physician?
For example, if I'm having, I don't know, let's say I needed to have a wart removed or
Yes,
something.
yes.
And I needed to see that guy, and for that initial visit, you gotta go in and do the 35 pages of paperwork and go in and he does the exam, and then, the next few visits between the elective procedure, and rather than coming in and sitting for 15, and then seeing the 15-minute visit, are we doing, is that something that's being offered still?
Yeah, we are seeing it. I know that my doctors, I see a provider out of Atlantic General, and there's oftentimes, annual checkup, a lot of times they do like to see it in person and things like
Right.
that, but they are seeing that, you can request a virtual visit if you'd like, and I don't see that necessarily going anywhere, particularly in the example you just gave, where if it's something where...
I don't want to have a wart, just so you're wondering.
You're requesting that visit, or, it's not something that is your annual, but something cold, cough, and flu type that I think that even your local providers are even moving towards that virtual medicine space as well.
I know personally, my doctor has suggested kind of like on in-between visits virtual, and we've done those, and they've worked out well. And then I've also used the CareFirst app personally, where I've, had something going on, cold and flu, and they see me over a FaceTime type video, and there you go, I got a prescription called into my pharmacy. So it's definitely something I think that's here to stay, and it's definitely something we've seen a lot more utilization on. So I do think that is bringing costs down as well. So, and just so...
I have a quick question. It's my understanding that a lot of people or families are using emergency rooms as their primary care,
Yes.
which is significantly driving up rates because they either can't get a primary, they don't know how to get a primary, or they don't know about telehealth. Is that true?
It is, in a lot of cases. A lot of folks are saying, I don't have a primary care, I just go to, West Ocean City Injured Illness, and, that's where I go, right? I'm seeing what I'm seeing when I'm sick, and that is what it is. So, absolutely, and it's a big area where we like to focus on education, so not only during the renewal, but once we start to look at open enrollment coming up here in the next couple weeks, all of these things we're talking about, the focus on telemedicine, the focus on finding a primary care physician and, utilizing, who is the best person to reach out to? Is it telemedicine? Is it urgent care? Is it primary? Is it, my arm is going numb and I need to go to the emergency room? Focusing on those things as far as our ongoing education with the employees are all going to be critical, so that we don't enter into a situation like that where our members are now saying, well, I don't have a primary, so I went to the emergency room.
Right.
Because when they do that, that's going to increase our costs. Not that we're not helping them out if that were to be them, but if we can steer them towards those lower cost care centers and still, getting adequate care and more appropriate care. They have a relationship with a provider, they're being seen, they know their history, whereas the doctor's emergency room maybe doesn't have all that. They're just treating reactionary, what's going on right there. Having that focus on education, is going to be critical, just to make sure that we're continuing to see that utilization trend go down. But you're absolutely correct. That is very common, and something that we're focused on not only at the town of Berlin, but with all of our clients is, promoting primary care physicians. Where do we go when we need to be seen for X, Y, and Z?
The other side is by sticking with CareFirst, isn't there a mechanism built in where you get a credit or something where if you go see a primary care physician, I think the other important caveat is to just say that a primary care physician is not the hospital per se. They may be affiliated with a hospital group,
Right.
but
Yeah.
is there still that credit within CareFirst for?
That is, are you talking about, when you're saying like...
I think
guess
that part of the receiving
The
certain.
Blue Rewards program. With
Yes,
CareFirst.
yes, that is still, and that's one thing I was going to touch on, that I've gotten really good feedback on the Blue Rewards program that they offer. I know a lot of employees have received benefits from that, and I've sent out instructions on how to access that, and I've had employees in my office and walked them through how to access that, and doing the, there's the real age test, and then there's, you do fill out a form that you get your primary care to sign off on, saying that you were seen, you input your information, and then you can get things like, I mean, I've seen employees where they come back with $300 at the end of the year that they can then go buy prescription glasses with or
Correct.
something like that. So it can be used towards anything, medical, health, dental, vision, you know, and a lot of people are taking advantage of that program. So I think that's a big plus of Care First too. I know some other carriers do offer those same types of programs, but I've seen really good feedback on Blue Rewards. And then with bundling, our dental and vision wouldn't change if we were to go with the Care First again. One card, it's your dental, vision, health. It makes it nice and easy for employees. It meets the needs of all of our employees. I haven't heard any complaints about Care First, and they have obviously a very strong network. So it just gives a little bit more stability to the employees.
Kelsey
So-
and Zach, sorry to interrupt. On this sheet here on the bottom, these are my main questions that are at the moment. We have the current monthly total of $89,499.
Mhm.
Now this loyalty credit, is that just the monetary amount that has been dispersed as a credit to the
We will get it in the bill.
Correct.
This will be, am I correct in saying, like, in this past year, our monthly current comes in at that 89, I mean, that, it's with that 38, and then they give that 38 back in our monthly bill. That's how it worked this past year, so.
It's a premium credit that you'll
Yeah.
see on your bill.
So then is the 89 actually
The-
89 is our current,
51?
No, so the 89 is what you all are paying right this second. So that's your current monthly total for this
The
snapshot at
92.
the time with these, 58 plus 6, 64 employees on your bill right now.
The 92 is with that 38 credit.
Gotcha. So what's the monthly credit adjusted? for
That's just
3,000?
taking the 38 and making it a monthly amount. The 38 is an
Just for
annualized
simplicity.
credit. So it's just that it's a one-shot premium credit. They're gonna give you $38,000.
I think we
And-
saw it last year in like our September bill. It came a couple months into the plan, it was just a huge credit that hit our bill. So basically, we almost didn't have much of a bill that month. But, so it's broken out, it comes in one lump sum, but it's, throughout the year, it still brings our total to that 92,822, so.
Thank you. And then my only other question on this right now is, what's in front of us here, and if I understand this correctly, the only folks that would have a co-insurance would be
Delaware.
the 6 folks in the Delaware plan.
But they wouldn't see any change to their plan. The town would be, this is including the town taking that 30% co-insurance. So the employee won't see a change to their end.
Okay. Thank you.
That's pretty great.
Correct, and the risk for that co-insurance, that 30% on that Advantage plan for the folks who live in Delaware, getting to that, the risk exposure we have for hitting that 30% co-insurance is quite low.
Yeah.
It would be somebody, going through their whole entire deductible, they're $4,500 from the town, then they're $500 for themselves, and then they would have that remaining $1,650 that they could comprise with that 30% co-insurance. So the potential for somebody getting that is quite low, but it is there, and we're taking that into consideration. But adding that, and this is again to Mr. Fleetwood's point, insurance is a game of accepting and transferring risk. When we're able to accept a little bit more risk as an employee, if I add that 30% co-insurance versus the 0% I have right now, I can see my premium come down.
Yeah.
So that's why we're able to see a lower rate in our monthly premium for that particular plan with the 30% co-insurance.
And I wanted to point out too that 52% utilization is not just based on the last year or two. I want to make sure that's clear. I know that we touched on COVID and seeing a change in our healthcare utilization, but that's based on the long term. Chris has done his research to come up with a good percentage, because we have not been hitting that 60% over numerous years now. So it's not just because of COVID or anything. So we feel comfortable coming at a 52% utilization. And then we did put in there that 10% for that co-insurance, just in case that were to be something, that we saw, but we really don't think the likelihood of hitting that is very high either. So we can go on to the other plans, and then we can come back if you guys want to, ask any questions at that point. UHC originally came in at their 4.49, but once we factor in our HRA plan, that came down to a 2.84%. And I had sent this back out to you guys. When I sent it to you this morning, that current monthly total, for some reason, that was a little bit off when Chris sent it, so it should have actually been that 89,499. And this is on slide, I'm sorry, we lose the page number there, but that's 9. Oh, it's there, I just wrote over top of it. But, so you'll see on that slide 7, we had that 89,499, so he just had an incorrect number there. So that is actually an increase of 2.84, so less than 1% difference between the CareFirst and the United Health. But the max out of pocket and that coinsurance is slightly higher, so we're taking a little bit more risk there. So if you look at the healthcare renewal for United Health, it has a coinsurance of, sorry, I'm losing my spot here, of $2,000 for an individual and $4,000 for a family. So that means that the town's taking on you have a little bit more risk with that. The potential for that HRA funding having to be a little higher is there. So, and again, we try to keep that low at the 15% on this one.
And just food for thought for the UHC plan. Again, CareFirst is a recommendation. With the UHC plan, it would not be a Maryland and Delaware plan anymore. It would just be one single plan. UHC would cover both states.
So there's nothing wrong with this plan. It's a good plan. We just felt like for less than 1%, keeping employees stable, giving them the plan that they're used to, that we've had no complaints with, that has that rewards program. It's got really great telehealth. You can get on their app and you can get an appointment. I mean, I could probably get on right now and get an appointment. So it's really friendly to the employee, and we've received a lot of positive feedback. And so when Chris and I spoke, and Zach now as well, we felt like for that 1%, it just didn't, it wasn't, like I said, it's not even a full percent. It just wasn't worth changing the employees, getting them out of that comfort zone and what they're used to. And the risk was a little bit higher with that coinsurance if we did end up needing to use that. So.
And we're talking less than $800 across the employees.
Right.
Just for everybody,
Yes.
1% can be
Correct.
I know.
Thank you.
I know.
less
Yeah.
than $800.
Does CareFirst offer like a wellness program? Is that part of the loyalty program where you get
It's-
credit for going to the doctor?
No, so the loyalty is, so just for the loyalty's sake, loyalty is our loyalty
It's
to
our-
CareFirst, the
yeah.
town sticking with CareFirst.
Not the employee.
They do have a pretty robust wellness program, utilizing the Blue Rewards like we talked about, that the mayor referenced. So Blue Rewards is their most accessible wellness program, in that if you go to a primary care physician and get your checkup, actually, let me back up. Before you do that, before you go to the primary, you do what's called a real age test. You take a quick health survey and it says, okay, I'm 30 years old, but I got this, and this going on. So my actual real age is a 32-year-old. Okay, I'm 2 years ahead of where I should be. I need to be 2 years healthier. And then I go to the primary care physician and I do my full checkup. 6 months later, I do the test again. And now I say, oh good, I've been following the rules that the primary gave me. I've been walking, I've been drinking a little bit more water. And now my real age is back down to a 30-year-old. Life is good.
It is a self-assessment, so
Correct.
it's kind of, you can say what you want to say on it, I guess.
We're checking those.
Right, but what I'm after is if you do this wellness, is there an option for like a copay to be waived?
So in the Blue Rewards program, not necessarily a waived copay. Remember, your preventative visit is covered at 100%. So if you're getting your checkup and you're using that as for the Blue Rewards program, that's covered at 100% under the Affordable Care Act. But going and doing those couple things, doing your checkup, still, doing the test online the 2 times, members have the opportunity to earn $175 from CareFirst on a special little
Get a credit card.
Visa credit card that they can use towards their qualified
It
medical
has to be used
expenses.
during that plan year, but they give you a credit card, they'll mail it to your house. It's basically acts as like an FSA card. It can be used towards, you can use it towards so many different things. So you could use it towards co-pays, you could use it, as I gave the example of sunglasses, glasses, prescription. You even get a credit for just assigning yourself a primary care physician. You can also speak with a specialist if, say, you were trying to quit smoking or lose weight. You can do one-on-one appointments with them, and you can earn up to $200 from doing those one-on-ones. So, I mean, it's a really, really good program if people utilize it. And I try to send stuff out about it. We talk about it during open enrollment, but, you can only lead a fish to water, or whatever the saying is. I can only push the thing as much as I can, but, I can't make them do it. So I've got several. I mean.
Because people like those.
Well, I did put together, if you recall, probably a few months back after our first call with Chris this year during the renewal, Chris had said, you know, he couldn't pull an exact report because of HIPAA on how many people have utilized it, but I think he got an idea from CareFirst, and it was probably about 30 to 40%, which did surprise me, but I have had several employees, like I said, come in my office, I set them up an account, I'm like, here, this is what you do. They go in then and do the test themselves and fill out the paperwork. And I mean, we're seeing a lot of utilization, but I put together like a step-by-step like screenshots. Once you get in here, you click this. Once you get in here, you click this. And I did send it out to all users, but I'm happy to continue to do that stuff and promote this program because I really do think it's a great program. So that is something. It's not, the loyalty credit is more to the town, but the Blue Rewards program is more on an individual level.
And members also, all members also have access, so the Blue Rewards is the fun one because you get the money and all that, so everybody loves that. And members also have access to ShareCare, so everybody has access to CareFirst Wellness Program through CareFirst by logging into the app. That's where it's the more traditional wellness programs, weight loss assistance, tobacco cessation, mental health focus. They even have some financial well-being things in there. That's more of the user guided, you know, let's help, you know, let's use the resources, who can we help you reach out to. But again, emphasis on these things, you know, ongoing education, you know, Kelsey, you know, doing an email blast, and we're happy to support these initiatives, you know, come in and do a, you know, quarterly wellness Zoom meeting, you know, something like that. These are all things at the end of the day, if we're getting our members to quit smoking and things like that, are going to be lowering our risk exposure over time, and ultimately, hopefully, we'll see lower rates.
And speaking of health and wellness, during open enrollment, the county has agreed, now that COVID has kind of slowed down, the county has agreed to go ahead and come back out and do this health assessments during open enrollment, so that's really great. They stopped doing them during COVID, but that's just a side note for you also. But, okay, so so CareFirst, I think, I mean, United Healthcare, I think, is a very viable program and a great option for this year as well, but I think it's our recommendation to go ahead and stay with our current carrier for the reasons we've just stated. So we'll touch on Legit right now as well. So Legit is a self-funded plan, and this can kind of go either way. You know, I'm going to look here at Zach to probably explain some more of the differences here, but they have a lot of positives and negatives. I'll go ahead and just start with the actual plan that we've been presented here tonight. They came in at that 7.27, but you can also, it's kind of, because it's self-funded, it can kind of go either way. So you may be better at explaining that part. But
no problem. So what a self-funded plan is, and so what Legit is the local government insurance trust. This is a captive program through this Legit is what it's called, LGIT, that is administered by a company called Benecon. It uses Cigna's PPO network. Nothing wrong with Cigna's PPO network. It's not as strong in our area as the CareFirst, Blue Cross Blue Shield, HMO, or the Advantage network, but nothing wrong there, national network. The big thing with this particular option is that it's a real big risk or reward. We could see a big reward, and that there could be a potential for a savings for us, although no immediate savings up front. That's important to keep in mind here for the moment. But there is a degree of risk associated with these self-funded plans. So a self-funded plan, as opposed to your fully insured plan that you're on with CareFirst, Blue Cross Blue Shield, or United Healthcare potentially, is your contract with the insurance company. It's your health insurance plan that CareFirst handles for you. Self-funded is our health insurance plan. This Legit is a little bit different, and it's our health insurance program. It's you and other municipalities that are all paying into this thing together, but it's a very small risk pool. The assumption being is that our risk in this little risk pool is better than the big risk that we'd be looking at through the state of Maryland and with the other groups in your cohort with CareFirst. That's great. If the risk is good, the rates are good. However, the opportunity for the rates to be bad is also there. If we, at the town of Berlin, happen to have a high claims year where we have folks who are, you know, getting surgeries, ending up in the hospital, doing the things that we just talked about that we don't want to, you know, we want to try to educate against, we could see these rates go up.
And they do not have a cap, and Legit is this is a 2-year plan. So we commit at year 1, and then there's no cap on year 2. So year 2, I did ask them if there could be some sort of not to exceed language in there, and they said that there is not. They did say that Legit has some language like that in their their plan with them, but it's 35%. So they said the highest they've handed out was a 19% increase. But they said that that was a very, very bad year for that particular organization. But I'm just not comfortable, and I'm sure you guys aren't either, with the fact of not being able to really have any other option in year 2 if they came back at a really high rate. And they like he said, they have a pretty weak network on the shore here. For example, there's really only like one ENT down here, and they're not network. Chiropractors, I know a lot of our employees see chiropractors, they have a really weak network down here. Mental health is a really big struggle for Cigna down here, as well as like those family medicine type offices. So, and we are on the Eastern Shore. We have a lot of employees that use those types of facilities. So until they have a stronger network down here on the shore, it would not be something I would recommend. But I think they're a good plan to keep in mind for the future, because they do have a lot of transparency. You get money back if there's surplus. They've handed out a lot of surplus funds to organizations, but the only other organization on the shore is Kent County. They're the only other ones down here in this plan. So I think it's something to definitely keep in mind, but I think right now it's with viable options. Otherwise, I wouldn't suggest this year, but.
Correct, and Kelsey, now that's kind of the big thing with Legit for this year, is that long-term strategy-wise, something like this would make a lot of sense for the town. This is something that, we certainly want to keep on the radar for years going forward. However, we have such an excellent renewal with Care First to keep everything the same, to keep that continuity with the employees, that it's not worth the opportunity to present that risk at this point. Again, no immediate savings up front for going with this plan. Without that there, and the pendulum could swing the other way, we do not find this is a strong recommendation this year.
If Care First or UHC came in with really high rates, then this would definitely be something we would be considering. But I think right now that would not be our recommendation. So, but Chris did put together a couple of slides just to kind of, which I'll just kind of go through these quickly. But these are the current Legit Health members. As I mentioned, Kent County is on there. Chestertown's on here, but that's only for ancillary benefits. So there's really not much activity here on the shore, like I mentioned. But they do give out the surplus for if you have really good plan years. Obviously, that's not a guarantee. But
yeah. So just regarding the surplus, so just and not to backtrack or spend too much time on this, but if we're looking at slides 10 and 11. The slide number 10, where it says that this is your Legit single plan option premium at max. This is the max rate. This is assuming that we're going to have the high risk. They're always going to bill us at this highest rate. These are the rates that we're going to pay for our employees. That projected cost down at the bottom is after our risk that we've considered in the group, and the surplus has been applied. This is where it would all shake out to at the end of the day. So this is assuming we're going to get a surplus at the end of the year.
This is the hopeful number.
Sounds like a lot of hope in it.
It is.
Correct.
I mean, but that's like we said.
Absolutely. And that's it. And like I said, if we were all sitting here looking at this big renewal increase from Care First or something like that, we could chase this, and this could be a good option for us. Or if we were all sitting in here knowing that we had the healthiest group of employees on earth, and everybody was 25 years old and as healthy as could be, this is a great fit. But again, versus Care First, United Healthcare, not a great fit today. But long-term wise, something we want to keep on the back burner, something we just want to begin that conversation.
And I may be wrong, you may know, this has been around, what, 15 years?
It's been around, no, not quite 15, I'd say around 10.
Okay, I know Kent said they've been members for about 8. But it's, and Kent had very positive things to say about it. So I think it's not something that we would, like I said, count out. But I think until we have like a bad year where everyone else came in pretty high, I'm not comfortable recommending this.
And the other thing to think about, without getting into specifics, again, insurance is a risk. Self-insured, it's another type of risk, but you've got to take a look at the demographics of our workforce. And we've got roughly 35% of our employees that have got the silver hair. I'll leave it at that. So that's reality on something for a second.
It's true.
I got
Yeah.
And to answer your question, I think they started in FY11.
Okay.
Because it says $21 million returns since
Okay,
inception.
yeah.
10 years.
Yeah, I was thinking it was between 10 and 15, but yeah, so I think, like as I mentioned, I think our recommendation is going to be Care First, and open enrollment is scheduled for May 17th through the 19th. So we do need to get this information back to Chris's office to go ahead and get them moving forward on that, all that renewal paperwork and stuff. So I'm not sure if you guys are, have a feeling on this tonight, or if you're
Well,
comfortable.
we can't make a decision in the
Right,
work
right.
session.
I know.
But what I think we can safely say, based off the presentation, is that Care First, which is our existing insurer, is very competitive. So I don't know if anybody on this body would like to see us change directions. If so, speak now. Otherwise, you'll probably see an introduction with
Yeah,
Care
nothing is
First, so
going
we
to
can
be
move
signed
forward.
off on, right now, but they need to at least kind of get some things headed in a certain direction. So we are looking for some sort of
Well,
recommendation.
just speaking for me, is I would have no problem seeing your Care First, your recommendation in front of us again. But I do have a question about the LGIT. I don't know if you can do this or not, but I would be curious to see what their second-year rate would have been next year, if you can provide them the data.
Sure.
And they can
Oh,
calculate.
you're saying based on this
Yeah,
year's thing?
based on,
Yeah.
if we were to go with them,
And I
what would it
think
have been?
did we ask
If
them
we
that
don't
on
go.
my call, if they could?
We did.
We did ask them if they could give it to us based on kind of let's pretend the last 2 years. And at that time, they told us they could not. And we also asked them about, we said, if we gave you probably 7 or so providers we know a lot of our employees use, would you be able to maybe, since it's a self-funded plan, go to those organizations and say, can you guys, get on board with us? And they said, we'll have to get back to you. So, but I can ask them again when.
Well, sure,
once
and
we-
even
yeah.
if, just not a whole lot of time on this, but even if maybe you could reach out to one of these other municipalities or MML
Yeah.
itself next year and
Yeah.
see what the average increase is. I would just be curious to see what it is.
You're not gonna get that because no two apples are the same.
My only thing
I
is,
mean,
They did tell us this year's average increase was a 5%.
Yeah.
But across the board, if you want to
Okay.
look at an average
That
increase,
would
but,
be fine.
yeah, so. But they said they have seen the highest of 19 and this year, and they have seen some negative renewals because it's maybe a newer group that they didn't have all the data before, so now they do, and they've come in even lower than current, so it's across the board.
And what we're hearing, I think, is that it's not necessarily the cost savings, but it's also the provider network.
Yes,
Sure.
It's very
Yes.
limited as it's associated.
Yeah.
We were with Cigna 4, maybe 5 years ago. We went with Cigna, got a great rate. We got through that year, but I will tell you, we've got 4 or 5 employees that have dependent children that have some very unique scenarios. But it did cause them some heartache. When I say heartache, what we ultimately did, we did an add-on rider, if you will, for those folks. But Cigna's the network's gotten better, but it's not quite where the UHC or the Care First network.
I guess what I'm saying is, like you said, just keep it on our
Yes,
radar
yep.
and see, because a lot can happen in a year. They
And
get
the-
better with their
yeah.
telemedicine.
Mhm.
Absolutely.
And this year, just for the record, like I said, they did say 5% was their average this year.
Kelsey, good report. I agree with your recommendation of sticking with Care First.
Great.
yeah,
Thanks.
I don't, the Cigna button legit, I keep thinking MC Hammer in my head. And I'm not thinking MC Hammer, well, anyway.
This is
I'll
when we
stop
might
with that.
quit for now.
But what I'll say is this, just looking at the list of towns and municipalities that are associated with or affiliated with the legit plan, these guys have easy access to
Right.
doctors and things across the bay.
Yes.
Kent County can cross the Bay Bridge like that to be in Annapolis
Mhm.
to see doctors where Cigna or whatever the other
Yeah.
person is readily available. That's not something that I can put my 9-year-old in the car and drive him to the pediatrician in Annapolis on the regular, so.
Yeah, and you're right on that. Kent County obviously is very close. They have a lot more access than we do, but they did say they've been with them for about 10 years, and they said pretty much from the onset. That it was 10 years because they said from the onset, and they said that the first couple years were a struggle to get people, local doctors and stuff in, but they eventually were able to, do some convincing with the organization after a few years and get some more people on board. So it's definitely something we'll keep in mind for the future, but it is kind of ironic, Cigna is their plan, but Cigna declined to give us a quote personally, like Cigna the group, but when we go through legit, we got a quote. So it's just kind of ironic, but they operate as two separate entities, I guess. 'Cause
It borrows their
Yes,
network.
Yeah, so.
Now, the one thing that I didn't see in here, and we had discussed this early on in the healthcare part of things, and Chris usually likes to talk about it, is the ICRA. Is that not competitive at all? I'd just like to keep an eye on where
Yeah.
that is. Once again, you said if the numbers come back higher, those are some options we have to look at.
Absolutely. Yeah, the ICRA is absolutely, so individual coverage health reimbursement arrangement. ICRA would be breaking the group health insurance plan at the town of Berlin. The members would go onto their own, they would buy their plans through, it would be a guided experience. We would, walk and talk and feel very much like their health insurance plan now. But they would buy their own health insurance plan through their home state. So most of us here in the state of Maryland, our folks in the state of Delaware would buy their plan through the state of Delaware. And then we would use an HRA to offset their premium costs, to, bring their premium costs to whatever they need to be. Still totally an option that we're taking advantage of in 2022 and things like that. ICRAs are generally reserved for groups that are seeing large renewal increases, just because that's, they're the groups where it makes sense to break apart that group health insurance plan and put them onto the individual plans. We're happy to show it to you if you want to see the numbers.
I would like to know offline
Sure.
where that came in at, just
100%.
because like what we're monitoring with Legit, we
Yep.
also monitor the ICRA year over year.
Absolutely. Yeah, we can
Talked
get it
about
for
it
you.
originally, I don't think,
Yeah, it's
hands
not.
down, we're not looking at it for this year. but
Sure.
I just want to know
Of
where
course.
we're at.
To make it simple for everybody, what does that mean? Today, we have one plan, a group plan, 58 covered employees. If under the ICRA, some folks' premiums go up, some folks go down. I mean, normally. But what you ultimately have, instead of having one group plan, you now have 58 individual plans that are managed by these folks right here.
Correct.
Yeah.
And
Which,
your
once
plan
again,
is
to
based
reiterate, we're not looking at.
It's
it.
Yeah, no, yeah.
It's a
Thank you.
good strategy, but maybe.
It's something definitely Chris
Just
has
wanted to
said.
have
Absolutely.
He says he sees the future heading kind of more towards these individual plans, but right now the group plan's still working somewhat to our favor, so we'll stick with that for now. But
All right, if there aren't any more questions, I appreciate your time.
Of course, thank
We
you
all
all so much.
appreciate your time.
Thank
you. Thanks, Zach.
Thank you,
Guys.
Kelsey, thank you, Chris, that you're watching.
Thank you, Chris.
yes, Chris is.
Whatever you want.
Yes.
That's that.
Zach and Zach, yep, it's
Yeah.
the Zach and Zach show.
Well, thank you guys, and thank you,
Thank you all.
Zach.
Have a good night.
Thank you.
Tell Chris I hope everyone's doing well.
Will do. Thank you
You
guys.
guys, what is this?
We coordinate.
Regularly.
We text about our shirts. All right, let's move on to agenda item number 2. My statement is brief. This evening, we're going to cover our enterprise funds, the main generation for those funds as far as covering our costs are through fees for use. And with that being said, this evening, we're going to discuss the water fund, the wastewater fund, the stormwater fund, and then our electric utility. So with that being said, we'll move into an overview of our enterprise funds operation from the town administrator.
Good evening, Mayor and Council. What I'd like to say, I've said prior, but I want to share again that this is the 23 budget process has been going on since December of last year. We really buckled down January of 22. Everyone, I look around tonight, we have 2 department heads, Tim and Jamie from the enterprise funds here. These two guys take this very seriously, and we've shared time and time again the unbelievable cost to do our jobs, and these costs continue to rise. Our enterprise capital has been discussed in a workshop. As you're all aware, capital ages, things wear out, we wear out, and when things wear out, we have a number of concerns. Functionality, safety, and can we do the job? So these 2 departments that are here tonight, electric and water resources, they represent roughly $12.4 million of the town's budget. It's a lot of money. And I do want to say, who's going first, Tim or Jamie? Or
We're starting with
Jamie,
water resources.
okay. So what I'd like to say about Jamie, and I had the conversation with him before we came in here. Jamie's been here for a number of years, and I asked Jamie, what are his favorite pet peeves, what are his favorite things that he's seen accomplished since he's been here? A new spray site, roughly $4 million for the spray site, $2 million for the force main. I know his favorite project, hands down, is Graham Avenue, because he got to play in the dirt. That's a $150,000 project that was, the majority of that labor, if you will, was provided by the town. And then the treatment plant, when we upgraded that, that was another $12, $13 million project. So a lot of investment, a lot of time has been invested by him and his department to make those things happen. Then you switch over to Tim. I'll tell you, again, the thing that's just absolutely amazing, and I want to applaud Tim 10 times over. When Tim started here, electric rates were running about 18 cents per kWh. Today, they're running about 12.5 cents. It's unbelievable. We just said things are going up in cost. I don't know how he's doing it, but he's doing it. So the things that Tim has done in that department through your all's approval and vision, he's replaced, I mean, I don't want you to get into it tonight with the ABB switches and, okay, but he's done a lot of infrastructure upgrades, a lot. And the one thing, Tim, that I remember that you shared with me probably 6, 7, 8 years ago, you came in and told me, I forget what they're called, but on the power lines, when you could come in at night and you know where the outage was. And I know that's helped you out immensely, because if you think back to 12 years ago, you had power outages weekly, okay? And you have them now how often? Self-induced is one thing, but the ones that we don't plan, they've gone down significantly. Since Tim's been here, he's added a new state-of-the-art Carter Cat genset, a natural gas genset. I mean, I can go on and on with the things that these two guys have done. So I applaud you, I thank you, because I know your mind is where it needs to be, and you've always got the interest of the citizens on your mind. Thank you.
Thank you. All right, so let's go into agenda item number 4A, which is an overview of the water fund revenues, and Natalie, our finance director, will provide an overview.
Good evening. The revenue projections, the main
And
revenue
we're,
is...
just a FYI, we're on page 9 for everybody. Thank you.
The main revenue derived from the sale of water services, basically the fees charged for the water being consumed by the citizens of the town of Berlin. If we go look at page 9 on the top, special connection fees, those are projections derived from the sale of the special connection or EDUs. The estimated amount to be collected for fiscal 23 is 100, is a combination of commercial and some residential new constructions coming in. The part of the water is 4,425, so basically multiply by 100, estimated to be collected, is roughly to be $442,000. The water service, the estimated projected amount is $725,000. Taking into consideration of average monthly collection, we are in the months 9 for the billing, and factoring some increases for the new potential development, an increase of $55,000 for fiscal 23. Ready to serve is a reserved fees collected for people accessing water connection infrastructure of the town. The amount is budgeted at the same of $24,000. Next one is services and materials. Those are invoiced revenues through the water department providing services, use of equipment and material to the development of residential buildup. Water tower rent, we have several satellite companies accessing and placing the water satellites on the water tower, and they're paying annual fees for the rent of the water tower roof. Interest earned is the monies from the bank account. Interest on delinquent is the fees collected for non-payment or late payment of the water services. Miscellaneous income is several items, basically refund from the discount on the scrap metal or small amounts collected for non-service revenues. And there is a advanced from the prior year special connection fees to cover a portion of the capital project budgeted for fiscal '23 of $150,000. Total for the fiscal '23 estimated, including the advance from the connection fees, is $1.4 million.
Natalie, can you explain to me, please, the ready to serve and the fee associated with that?
So if you have an undeveloped lot or you have a potentially future development and you would like to have a reserved connection for the future, you're paying, it's basically equal to a minimum bill every month's fee to be able to then later on install the water meter and connect to the water lines.
Thank you.
Thank you. Jamie, do you want to share with the revenue line item your potential ideas with the miscellaneous income?
Yeah, next meeting, we should be able to go in front of the mayor and council for approval of our smart meters. And what my thoughts are is when we replace them, we'll put them in a tote and sell them on Gov Deals, and that way we don't have to mess with them, and people can come here and pick it up and say bye to the scrap metal.
So year end, we should be seeing a little bit of a higher increase with miscellaneous income, but we are going to be speculative at $1,000 at this point. Thank you. Good idea. Up next is the water fund expenditures, and we do have our Water Resources Director, Jamie Latcham, here with us. So we'll take that. It starts on page 9 with Water Administration.
I don't think much has changed in the administration side. We've just incurred some of the costs with the natural costs of working every day right now. So most of the stuff is inflated just with what we've been seeing, 8% and 10%.
So let's pick it up. So above contracted services, not much has really changed at the department level. So picking up with contracted services, I don't think there's much of a change in that area. However, when we do get down to the capital equipment on page 10, we're looking at capital outlay of equipment. Jamie has requested, and Jamie and Jimmy Charles to share F550 dump truck, just to fill the entire group in here on what's changed as of this morning. MEA has issued an extension for grant funding for alternative fuel vehicles. With that being said, we're looking at applying for a grant to fuel the F550 dump truck, the 2 requested F250 pickup trucks, and an additional F250 pickup truck for water resources through grant funding, powering those vehicles by natural gas. So with that being said, we're going to keep everything in the budget, but we're going to apply for the grant for funding all of those vehicles through a grant. If we're successful, there would be an expenditure on the town's behalf potentially for a fueling station. What that would cost is rather up in the air right this moment because we're pursuing a couple different options. However, it should come in hopefully well less than the expense of an F550 and 3 F250s. So there's some real potential to fuel these things with an alternative, that being natural gas, and also maybe save the town a little bit of money in the process. So Jamie, if you want to talk a little bit about the purpose of the dump truck, I think we heard that from Jimmy as well, but just your plan with that.
Yeah, Jimmy and I are Public Works and Water Resources. We use each other's equipment. Trucks are getting older, and that would, Jimmy's actually getting rid of a 2000, and I actually would like to get rid of a 96 or 99 also, because it's just getting life expectancy and it's nickel and diming us to keep it on the road. So that, I'd like to get rid of that also when we do that. So we would actually be getting rid of 2 for 1. Actually, I think it's 3 for 1.
3.
So, I mean, and we use each other's equipment, and that's the way I feel the town should work. I mean, we're a group here, we work for the town of Berlin, so.
And that's why you see that charge out across two funds. The general fund and then the water resources fund. All right, you want to work down that line item? I don't think there's much that's changed in the vehicle maintenance, telephone, travel, cell phone. Let's see, office supplies, you see that, but that's Mary's domain, I believe, a little bit, right, Mary? With the change in some of that technical
These
equipment.
particular items, yes, that are related to computer.
Are these the ones, are these your, I can't remember.
You'll see
These
them
computers
across
that
the
are,
funds.
that are scheduled for replacement?
Yes.
I don't think so. They're not, you're asking the question if they're the computers that are scheduled for replacement?
Yeah, is this through the cards agreement?
I think you'll see that in the office supplies, I believe. I think what you're seeing here, okay, my apologies. My apologies, I stand corrected.
That's this right here.
You're right.
Okay.
We'll see the other portion in electric, I'm sorry.
That's all right.
All right, working down page 11, you'll notice there is a contingency, but that is with the salaries are flat right this moment. Whatever we do in the general fund, we would apply to our enterprise funds as well. So you do see that contingency of $47,000 there. Anything else, Jamie, at the top of water, or page 11's water administration?
No, do you all have anything for me?
No, I have something for the mayor,
Go ahead.
since we mentioned the grant. Is it an all or one, is it an, with this grant, are we looking, is it a dollar figure or is it vehicle based that we're looking at? When you said applying for it, it should cover,
Dollar.
There-
Okay.
Yeah, so what we would be doing is applying for the full cost of the vehicle.
all three vehicles combined?
All
Or
four, actually, yeah. So
Four.
Jamie's truck would actually be something that we would need to be looking at replacing. We don't have the available revenues in FY '23, but I think we talked about that in FY '22, this fiscal year that we're currently in. So if we're going to apply for the grant, we're going to try and go for all three of them.
In the
Three
way,
F-250s and one F-550, so a total of five.
in the
Four
way,
vehicles.
in the way this works, I mean, Councilmember Nur and the mayor, we spoke about it in the conference room earlier. Bob Clark did a bunch of legwork on it today, and we've had conversation with Valerie Mann, the grant writer. The gist of it is you can go go to IG Burton and buy a Chevrolet pickup. Just go buy it like you're gonna buy it yourself, you know, a fossil fuel gas powered pickup. Then what happens when you buy it, you buy this retrofit aftermarket hookup, if you will, for compressed natural gas. That runs about $10,000 per vehicle for this aftermarket setup. So when you get that, you get the vehicle, you get the compressed natural gas. What I found fascinating on it, the vehicle can operate with gas or it can operate with compressed natural gas. So if I told Bob, I said, you get quite a bit of touring range on that. If you fill both tanks up, you can go quite some time because the mileage doesn't change. If the vehicle's rated at 18 miles to a gallon, you're still going to get about 18 miles to a gallon, whether it's compressed or liquid.
And the question would be why switch, right?
And it's,
But it's for the.
Free money.
Well, thank you.
Well
Thank you, Troy. But it is because we want to make the proactive approach of
Emissions.
making
So
the
this
emissions
There
of our vehicles much
So
better.
the inclusion of the aftermarket item,
Yes.
is that going to affect the warranty of the vehicle?
That's a no-brainer, is Paul.
I don't know that. That's a great question. That is a great
I
question.
missed your
Car
question,
salesman
Councilmember.
may say-
Yeah, I'd say,
That's a great question.
Look at Kelsey checking me out.
I bought a car from
The
Shanika
car
years ago.
salesman in me says, you better double check that part. That
What was your
The addition
question?
of the aftermarket item to the vehicle, is that going to adversely affect or have any effect whatsoever on the warranty of the
On the
vehicle?
manufacturer.
Yeah.
And
you
that's
better-
a,
you
that's a
double check
good
that.
question, but I believe the manufacturers sell the natural gas conversion, but we will double check that.
Double check it.
That's a great question.
Just a lot of times, even if they do, even if GM sells it because it's aftermarket,
Great question.
they won't, but double check it. That's just.
All right, let's pick up on page 11 with water treatment. Once again,
Mayor,
we'll.
just one on page 11 before we
Yes,
move
thank
on
you.
from administration, just to understand the line items, the general overhead is recalculated based on the balance of the funds and the general fund. So that amount will change once we get closer to the introduction and I'll get a better understanding for the personnel cost and recalculate the insurance at the current rate that we've discussed. Also, the customer service allocation, that's the amount coming from general fund, where the customer service, the whole entire department been split by the percent. 20% stays in the general fund, and the utilities funds pick up the rest by the percent as well. So that amount will change going forward as well, depending on the personnel cost.
Thank you. Let's move into water treatment, and we'll stay above the contracted services, or below the contracted services again. Jamie, do you want to take that?
Yes.
Overwhelming.
On the well preventive maintenance, we have in the budget this year to redo the Powell Avenue well house. Hopefully it stays, well, I'd love it to stay in there because it needs it. It's probably leaking right now with the rain out there, but I want to pull that well this fall before we do any building maintenance. Have the well videoed and do a real good inspection on it before we build a new building over it. So that if something has to be modified before we build a new building, we can take care of that now. I would hate to put a $300,000 building up and have to drill a well outside of a building, you know, a situation like that, like we had on Branch Street. So I'd like to try to do some maintenance beforehand too on that.
Thank you. Do you want to go to page 12 then?
Yes. We're also looking at doing just some build maintenance on the well house number 2 over on Franklin Avenue. We're looking at changing out our flow meters, recorders, chart recorders to be more accurate with the new meter reading systems. Generator maintenance, because hopefully when we do Powton, we'll put a new generator in there also. We have soda ash pumps in there and well pump equipment, but per MD, they would like us to look at switching to a different chemical. So we were looking at switching up our chemicals to a caustic soda, which everybody else is running now. And that's where we would like to start switching out, because it's more of a stable chemical to keep the pH level across town, not up and down like it has been. And that's also in the capital outlay too. But in capital outlay, you can see Powton Avenue well house in there. 3 years ago, when we started, Jeff, we were at 175,000, and we're at 300,000 now, and that's just because of, you know, lumber material have gone up, and that's why I said with the well maintenance, I'd like to do that before we build the building to make sure we're, you know, we do the right thing. And then chemicals have significantly gone up, and we've been hit with more and more cost rise and every time we order chemicals. Anybody have anything on that page? We'll go to water distribution. We'll start down at under contracted services. We have outside contractors. That's it. Sometimes we have to get other contractors to help us replace valves. Like I was saying the other week, I'd like to replace 5 valves and a hydrant all in one day. I know that's a lot, but it can be done with outside help, so that's why we put that in there. The census software is in there right now. It will probably be changed out with whoever we go with the new metering systems, but we still have to keep that in there so they'll honor the software system until the new system's installed. Equipment maintenance has gone up a little bit, which everything's going up. Street repair, we do have an aging infrastructure, so when we have to change out lines, and you know, when people build new homes and remodel, we have to, you know, or not remodel, but when they tear their houses down and put new ones up, we end up having to put in a larger water service due to the sprinkler system that the state of Maryland mandated. Water tower maintenance, that's just pretty much we pay that every year, but we get the money back from our well tower rental from the antennas on the tower. On the capital for distribution, there's I would like to connect South Main Street in Germantown under 113. That's half of it. It would be carried over to next year also. That'd be $600,000 to get under 113 to tie the two in, so it'd be a better loop system. The school field and all the valves, we would still like to change some of them out. And we've done a lot of work on North Main Street, so now we're going to start down on South Main Street towards Burley Street that way, because some of them valves need to be changed. The smart metering project, it'll be in front of you Monday night for approval to move forward.
And we already earmarked that 1 million, I believe, right?
Yes.
From ARPA, so that'll be brought back in as well.
Supplies and operations, I'm just going over some of the stuff that significantly jumped. I know it jumped a lot, but Councilman Brunel can back me up. We bought meter pits a year ago, they were like $400. They're jumping to $750, so they've almost doubled. So I know we had some money built in with the new smart meter replacement, but I do feel that we will have some water leaks because there's some old galvanized pipes in the ground. There's a lot of older infrastructure, so we're going to find out a lot more. So that's why we increased a little bit of it, because of blacktop is going up, restoration is going up, pretty much everything is going up. I mean, it's across the board. And
Question.
yes, sir.
Can we go back to the page with contracted services? And you said you were gonna try to install or replace 5 valves and a fire hydrant
Yes,
all
sir.
same day?
Yep.
What services would you need to contract?
Just an outside contractor to help us replace the valve, like a.
They would be actually helping to actually replace the valve?
Yes.
Okay.
We'll probably divide it into 3 different crews. The valves are behind the firehouse, 3 on Harrison, and there's a fire hydrant right down before Austin on the left that needs to be replaced. So we're hopefully, what my plans are is to excavate the one behind the firehouse, and we'll put steel plates over them that night. Excavate them the night before, so that way when we get there that morning at 8 o'clock or 8:30 when we shut the water off, we can get moving with it. Because the 3 valves are going to take the longest, so we'll start, only really the excavation we'll do that day would be the fire hydrant down by Austin. But I mean, you're talking a small area from, I mean, I say it's a small area, but you're only looking at Brittany Lane to Austin, just in that little corridor in the firehouse. So I mean, we'll coordinate it with them, and it shouldn't be 6 to 8 hours, we'll have it, should be all back on.
This would be a crew to actually do the work?
Yes. Because we'll be working on some of our guys will be working on fire hydrant, and we'll be working on the valve also, a different set of valves too.
Can you explain the benefit of doing that with an outside crew versus in-house?
Well, we'll only be limited to 1 shutdown.
Yeah.
I mean, if we.
I'm just asking for
No,
everybody
no,
to
I-
pay attention. But
If we did it with just the town staff, it would probably be over 2 to 3 different shutdowns.
Yeah.
If we bring an outside contractor in, my worst problem, not my worst, the worst one, not complaint, but the library. I do have to try to work around some of their schedule because they have some stuff there. So they'll be the only person that really commercial that will be interrupted. Everybody else, is mostly residential, and so that they'd be the only one.
But instead of shutting down
Multiple, 3 to 4 times.
you do it once,
Yes.
it would be done.
Yes,
the
sir.
value add is the less service interruption.
Yes, and that's why I want to replace the valves, because if we replace the valve and we can limit service interruption later on down the road, if something happens, a main break, we can go to these valves. Like the other week when we had to fix the leak at 219, we only had 5 houses out, versus if we didn't replace all the valves we had, we could have had 50 houses out. I mean, we had to actually take the corp out of the main because it was an old corpse and it wouldn't shut off. So we just actually were able to pull it out, put a new one in, and in 10 minutes we had the water back on. Maybe 20 minutes, I mean, to drain it, to get the pressure off, but it's the benefits of having workable and usable valves.
Thank you. So we're on page 14, I believe, and we discussed the meter pits. So I don't know if there's anything you want to highlight in supplies and operations or lab testing.
No, I mean, lab testing, all that has to be is par for MDE. And I know we've talked to pretty much everybody we talked to on the engineering and all them. They've price increased, so I'm sure lab and testing is going to increase, because what lab and testing we do, our prices have increased also, so.
Thank you. So if there aren't any questions, we'll move on to agenda item number 4C, which is the wastewater fund revenue overview, and our finance director, Natalie Slay, will provide that.
Sewer fund is mimics the water fund, the projections for revenue, the main source of revenue is the sewer services, the fees charged for the services that is basically based on the water consumption, and 60% go into the sewer. We have holo fees opt-out page, estimated to be collected at $150,000. Those are the fees charged for the outside contractors bringing the sewer to the wastewater facility to be processed. Special connection fees, it's the same amount of 100 EDUs estimated, a mix of residential and commercial. The part for sewer is $12,261, which will equal $1.2 million to be collected in fiscal '23. Ready to serve is the portion for the sewer, the same as reservation to be connected to the water sewer services of the town. A small amount for services and material provided by the department. Sewer services estimated to be collected at $2 million, basically the same scenario, taking the average of 12 months and factor the potential growth of the new residential and commercial services into the town. Interest on delinquent is the amount collected when the service has been interrupted for non-payment during the disconnects. And there's a small amount for miscellaneous income as well. So with all that is estimated of $3.5 million for fiscal '23 in the sewer fund revenues.
Thank you. Any questions for our finance director regarding the wastewater or sewer fund revenues?
Yeah, Natalie, just real quick, did we not, if I understand this, did we not charge rent for the spray site this year? Because it's zero. It's
It's
402.
2,000.
Right, but I mean, this year it's zero.
It was not billed in for fiscal '22. We were not sure if we have a contract in place.
Okay. Thank you.
Any other questions? All right. Let's move on to agenda item number 4D, which is the wastewater or sewer fund expenditures, starting with administration on page 15. And we can stay above the contracted service, or below contracted services. So I guess we're on page 16. Jamie, do you want to hit on the increase that we're seeing in contracted services? I think
Yes.
we said that was the engineering services, right?
Yes, some of it's for the engineering services. We have, pretty much we had put up, we have camera truck software that has to be done every year. That's to keep our license and our fees for the camera truck. And the generator services, we take out of there lift station monitoring, which is our high tide alarm systems, which are outstanding. And then we just put a little bit of money in for our outside services.
Thank you. And then do you want to just work your way right on
Yep.
to capital?
Capital outlay, we put a SCADA system upgrade. I had a company come in when we started budget season, and he told me I was about 4 to 5 years behind scheduling on getting it upgraded. And he kind of gave me a ballpark of what it would cost to get it upgraded.
Tell everybody what SCADA is.
It is what controls the treatment plant. If it goes down, then we will have to man it 24 hours a day, 7 days a week, until we get it up and running. So we're hoping that this will definitely go through so we can keep it. You know, it's a new system, it's upgraded. I think we're working off of Windows that was in 2009. So that's Windows ancient.
Pretty close.
And it, you know, so the thing is, they'll put a new system in and get everything established on the new computer, and we'll run the new system and the old system probably for a month or two. And then once everything, there's no flaws, they'll come and pull the old system out. But I've been working with Mary and Cards and Lywood Electric, because they're the ones that have the license for the software we have down there. And we're getting everything sorted out of how we want it and everything.
And just to clarify, this is separate from the rest of the IT that Cards handles, but Cards is involved in assisting us with working with the vendor.
But this is, but SCADA, I'm sorry, SCADA is not through CARD.
Correct.
No, they don't have the license and the,
Yeah, it's a specialized system.
yeah.
Is it network based?
I believe it is. I'm not for sure, I'm not a SCADA, I'm not a computer guy, I'm a hands-on, I'd rather get dirty than work on the computer, so.
So hold on one second though, regarding, are you asking for like security?
Security reasons.
So that was identified as a potential, with all this stuff going on in the
Yeah.
geopolitical environment, one of the things we did have to look at was the safety of our infrastructure. Part of that was an analysis of whether our electric or water services were vulnerable. The end-all be-all is that Cards has assessed both of those systems, and the way that they're structured, I think we're okay.
Okay,
If you want more information, we can give that to you offline.
okay.
So let's work down employee training, if you don't mind just hitting on the GIS.
Yes, Megan's been trying to get her qualification for the GIS, and we'd like to keep moving forward with that because it's, in due time, it's gonna be beneficial because not only with water or wastewater, but with water because of the new lead and copper rule of 2024, you're supposed to have all your water services located, so, that is part of our water capital outlay with the meters. They're going to GPS all of our meters, but it also is going to help us in, like if we have a snow event or middle of the night, I know people think that if they cover the meter up, we're not going to find it, but we will find it. But if they got water running out of their first floor of their house and they covered up with mulch, at least we can get there within a 3-foot radius and kick around and find it. So that's going to help us tremendously too, because like, as I say, people think, well, if we cover it up, we're not going to get our meter in, but we'll still read it.
Thank you. And Councilmember Warris, at the bottom of page 16, the information technology was what I got confused a moment ago.
Oh, okay.
All right, let's move on to page 17 if you don't mind.
Yeah, office supplies, that's our workstations and everything through Cards. Supplies and operations went up a little bit. That's just because everything else, our safety gear and everything is going up.
You'll notice the contingency, but that won't stay there indefinitely. That'll be adjusted a little bit for the staff allocation, like what we talked about a moment ago on the water side. Any questions for sewer administration?
Hey, yeah, speaking of those meters and covering them up, speaking of that, is there a fine associated with that?
No, there's no fine associated with it, but there is a $200 fine associated with it if you go in there and turn it off. I do love enforcing that. I've not wrote my one yet. I think Marvin's been here 37 years and I think he's wrote one.
What, were they turning it off themselves?
Yes.
Oh.
Well, we frown on it big time. We had a local resident or somebody turned it off, and when they did, they broke it. So we had to shut the main off and fix it. So yes, they paid a $200 fine and paid for all the material to fix it and all the time. And usually they're one of the ones that would like balk at you big time, and they never said a word and smiled.
Well, I only ask that, of course, because being out with you guys and then with Tim and his crew reading meters and having to literally climb over tires to read electric meters and then wave your way through bushes to find other meters and things like that, and the ones that are covered in flower bed mulch. Kind of, you know, I'm not saying don't call me up because I said to find you, but I mean, unless you got to go out there and read those meters yourself, that's a bit of a work. Like that day, Alan almost fell because I was about to climb. He was like, no, I'll climb the tires. And I'm like, whoa, I'm spotting you. You know what I'm saying? Things like that are hazardous to the workforce. And that's, I don't think people realize what the piles do for folks when they're trying to.
I mean, there's one development in here, there's 28, I think, homes in there, and all 28 are covered up with mulch.
We try to put it in our constant contact every year. keep it clear, make sure we put pictures of what it shouldn't look like and what it should look like, and we still get people that are.
But people don't understand, I mean, like I'm gonna say something for one, or say it, but, you know, like they said, they covered up, nobody, but man, they're mad with you when you get there at 2 o'clock in the morning, they got water running out of their house and you can't find that meter. Well, it's under 6 inches of mulch because you just mulched your flower bed. I mean, have a little respect for us. I mean, it doesn't take long to, hey, guys, can you all come by and raise my meter? What can you do? I mean, we're only a phone call away.
Yeah, or just little garden gnome on top of it.
Yeah, I would say some
and you
sort of
don't have to-
marking.
Yeah, I mean, you know, we paint the street blue. I mean, a lot of people, why is all of a sudden the lines out on the road blue? I mean, we try to mark all of our meters once a year. I mean, so if you see the blue mark, that's usually in line with the meter, but it's not in line with the water line sometimes, but at least that gives the guys a quick reference if they gotta get to it to shut it off.
Kelsey just had a great idea. We're gonna sell a Town of Berlin garden gnome.
You put it
That
over
they can
top
set
here.
right on top of the meter.
I think that's a great
You
idea.
have a yellow garden gnome in your
You
yard.
can sell it right out of Ivy's building or downstairs, but, I mean, think about
You make
it.
a profit, guys.
And we can break even.
You're right.
If you've got a lineman out reading a meter and he breaks his leg, he can't get on the line.
Well, I mean, I know this is a little bit off topic, but, I mean, one of our meter readers been bit by a dog, just
Yeah.
reading meters. I mean, so, you
They
know,
carry treats.
you know,
Yeah.
All right, let's pick up on page 18. The takeaway, keep your meter clear.
And your dogs.
And your dog's name. The page 18, let's pick up with contracted services working downward.
yeah, in contracted services, we still put money in for outside contractors. Over a certain depth, for water and sewer, or sewer, excuse me, we let them do confined space and trench safety. There's, in equipment maintenance, most of that's pump station and lift station equipment, which is valving and pretty much pumps. You know, pumping, we have 13 lift stations. Most lift stations have 2 pumps, so there's 26 pumps in town here that pump all, you know, off and on all day long. Street repair went up, and that's just because of everything, you know, materials going up. And we did put capital outlay, $1 million for Broad Street lift station. I think, I know a couple of you seen it, but it'd be nice if everybody would either get up with myself or Jeff and go by there and take a look at it. It's just a waiting time bomb to, you know, I mean, it's last upgrade or anything been to is 1970. I think I showed it in my meeting thing the other week, so. I can go on to the next page.
You can, I just kind of, what do they call it, a biology break? Too much coffee. So we're on, the walls are thin around here, so I can still hear your presentation.
Yeah, we're on page 19.
Page 19, and we'll pick up with the treatment plant.
And pretty much, I mean, supplies and operations went up. Some of our materials doubled and tripled in prices, so we've had to try to plan accordingly.
Any questions regarding the collection system? All right, let's move on to the treatment plant then, still on page 19 with contracted services.
And the reason we have outside contractors is also in there is because of all the controls and PLCs and the material there that we're not licensed and certified to work on.
And we'll pick up on page 20.
Yeah, okay, and we have it down here for equipment maintenance. We have a digester mixer motor that's we would like to replace due to the wear and the hours onto it. Our dry bed controls, they need to be upgraded because they're working off the old Windows system. The PLC that controls the septic receiving station needs to be upgraded. Treatment process controls and the SBR, which controls the SBRs, need to have a updated. The influent effluent pumps for wear plates and just maintenance done to them. And most of this is maintenance. Some of these pumps don't shut off. Some of them have quite a few hours, over 100,000 hours onto them since they've been put in, and very fortunate of maintenance being able to keep them going, but you know, stuff does break after time. And utilities were, you
Do you
know,
want to explain those batteries to everybody? I know it's a small expenditure.
It's
relative to
small,
the
but-
cost.
I was telling them earlier that the generator batteries, they're under charge 24 hours a day, 7 days a week. So usually the Albin or Carter cat people would like to see them changed on a regular basis, because it's an emergency generator and we want that thing to run. Because if not, it might be a bad time in town. But they're lead plated inside, so there's 2 batteries in there, and they're probably 3 foot by 2 foot, and we would like to replace them this year just because of where they've not been changed in like 3 years. So usually they're on their every 3 years they're up for replacement.
And you said it takes 3 people to change them?
Yes.
Give you a little perspective on changing a car battery. All right, then, yeah, if you don't mind, just the utility expenditure is $180,000, and during our discussion, we were talking about some potential ways to help offset some of that, and you'll see that cost carry forward, I think, to the spray site?
Yes.
There's a little bit of an increased expenditure there, so we want to look at, a few years ago, we explored what it would take to bring solar possibly to that site, and whether it was going to be a net benefit or not. At the time, it wasn't, but we're going to reevaluate what that would look like. So you won't see a change in FY23, but you might see something come before you during that fiscal year.
And I know people are going to, chemicals is doubled. There's not much I can do about that. We have to have that stuff to operate the treatment plant. We're very fortunate we don't use as much chemicals as some of the other plants around us, but I know for a fact I ordered polymer a year ago, and I paid roughly between $2,500 and $3,000, and I got a shipment last Wednesday, and it was $5,500 in just a little under a year. Supplies and operations, you know, just for the equipment to keep stuff, you know, maintenance at the plant going. And lab and testing has gone up. And where we have a little bit more sludge, we've upped our landfill charges also.
Thank you. Any questions for the treatment plant? All right, we're on page 21. Let's move on to the spray site, if you don't mind.
All right, pretty much we have a little bit on the outside services for down to the spray site. You know, one spray site's 1,000 acres, the other spray site's 500 acres. There's some stuff we have to do for our renewal of our MD permit, and that's a forest management plan, so that's probably our outside services for them to redo that. And not much else has changed other than the utilities went up, and we had put a little bit more in for equipment maintenance due to the fact is that some of the, you know, the pumps are, I know we got to do some maintenance out there on the pumps and the equipment out there.
And then if you don't mind, just to put on page 22, we're looking at non-capital equipment, just put that in perspective, that $6,000 charge for spray heads and valves.
Yes, so spray site A has roughly 6,000 spray heads. Spray site B has 618. When we've been changing the ones out in spray site A, we're putting a 3/4 inch brass ball valve in there so that if in due time you don't have to shut the whole field off, you can go out there and just shut individual heads off, take them apart to clean them, put them back in service, which will save a lot of time, because right now in spray site A, if he had a head pop off or get plugged, he'd have to ride all the way back up to the building, shut the pumps off, ride all the way back out, or go open another field and shut that field off. So for a small fee, we can start putting these valves in to help expedite the process quicker, to keep because that's one of the things MD will get you on. If they're not turning or if they're plugged up, they'll hit you up for that when they do their inspections.
And the $6,000 is for approximately 300 heads and ball valves.
Yes.
Any questions regarding the spray cycle? All right, if not, that concludes our wastewater funds expenditures. Let's move on to page 23 and agenda item number 4E, which is the overview of the stormwater fund revenue by our finance director, Natalie Slay.
Stormwater fund revenues, residential fees and non-residential commercial. Residential fees is the same amount per year per residential unit, and the commercial fees calculated per square footage. 76,600 to be collected in fiscal '23 is estimated to be an increase of 1,000. Non-residential fee, 101,000, and a small increase of $1,400. The stormwater review fees, 7,000. Those are revenues collected from the new development when they pay in advance, and then the engineering firm bills us, so that's a wash. You will see 7,000 expense line item down below, so it has no impact. There is a small interest on delinquent for non-payments of 700. Total estimated revenues for fiscal '23 is 185,000.
Thank you. Any questions regarding the revenues of our stormwater fund? All right, let's move on to the expenditures for the stormwater fund, beginning on page 20, I think we can probably just go to 24, couldn't we? Page 24. And that is agenda item number 4F with our water resources.
Yes, I mean, really, there's not much change in the stormwater. There's not much wiggle room to do much. So.
And just so that everybody's aware, the main generator of projects is grant funding. The main way that we cover the operations is through the fees for use. So basically, without having the grant funding within the budget or pursuing grant funding for a particular project at this time, we are just handling our operations and some of our maintenance that we need. So any questions regarding the stormwater funds expenditures? All right. Thank you, Jamie.
No problem.
And thank you, Natalie, for the revenue overview for the water resources. Let's move on to agenda item number 5, which is our electric fund, and we'll start with the revenue side, and we're on page 1 with 5A, revenue overview, finance director Natalie Slay. Thank you.
So in comparison, or to be different for electric fund, there are different levels of the services for electricity. We have our regular residential services, commercial, general service. We also have street lights and large general service. All those amounts been done as projections with help of our engineering firm, taken into consideration of the rates increase in the production or distribution, and also potential new accounts being accepted to the grid. So 3.5 million for residential services, 479,000 for commercial. General services approximately 1.3, street lights at 79,000, large general service 426,000. We have services and materials projected to be at 413, and basically what it is a developer reimbursed equipment that electric fund would be install in the future for new development, and then the developer will reimburse account for the actual equipment. Electric services and materials, it's what the electric crew charges when they actually work on site for the labor and trucks and the tools. There's 25,000 for interest on delinquent account, small amount for miscellaneous. We have discussed to conduct a rate study. We're past due on that and been talking about last year. So I think to move forward with that project, we approximately will need 140,000. That would be done with help of engineering firm. There will be some legal fees involved to present us in front of Public Service Commission. So that amount of 140, including the rebudgeting from fiscal '22, the transformers that we have a purchase order outstanding for 70,000, that's the line item contribution from reserves of 210 that you see there in the middle of the page. So total revenues for fiscal '23 for electric fund is $6.4 million.
Thank you. Any questions regarding the electric fund revenues for our finance director? All right, let's move on to page 2. Page 2, which is our electric administration, and that's agenda item number 5B with our electric utility director, Tim Lawrence.
Good evening, Mayor and Council. First thing I'd like to say is just to support Jamie on what he's talking about with the increased materials, chemicals, diesel fuel. We're also seeing the same thing in the electric department. Fuel costs, materials, everything has risen 20, 30, 40%. So you're going to see that in this budget, the increases. But I'll start out at professional services. You see a 145% increase. That's engineering and electric matters. That's Booth Associates for $110,000. They basically handle the regulatory requirements with Public Service Commission. I also call them at certain times to get advice on engineering on what size transformers, relays, that type of stuff. And then legal services, that's the attorney fees that go along with it, with our utility attorney. And then the biggest increase that you're seeing there is the rate case study. The last study was done in 2012, I believe, so we're up 10 years. And that's normally when you do another one, it's about every 10 years to make sure your rates are where they need to be to support the expenditures. And then from there, I'll go down to the capital outlay equipment, which is 5210. The biggest increase that you see there is the 55,000. That is basically for a F-250. That will be replacing 2 vehicles, which is the 1997 utility bed truck, which should have been gone many years ago, and then a 1994 Ford Ranger that's over at the power plant. So the vehicle that I have now basically replaced those 2 vehicles to be shared amongst the 2 employees. And then my vehicle will be the new vehicle, which is the F-250, which the mayor mentioned that we're looking at natural gas, going with that type of vehicle on that. And then if you go, I guess from there, we could probably go over to page 3. If you have any questions or anything, just stop and I'll answer whatever questions you need. The next one you see there is travel. You see an increase of 40%, and that's travel expenses for hotels, food. That's basically for all travel and training is now under 5,600 administration for the entire crew. So right now we have 1 employee that's in Step 7 lineman school, and then another one which is in meter school, David. So that basically covers the hotel, food expense, and travel expense. And then as you move down through there, you'll see another one which is 5620, dues and publications. You see a 35% increase there. ATSSA, that is American Traffic Association dues. Basically you pay a membership fee for flagging certification. I take care of setting all the employees up to take, we used to do the training in-house, but now they no longer do that. You actually do it right online. So they can go to a link, they go online to be flagging certified on that. The next one down is Maryland DC Utility. That's basically you pay Miss Utility a fee every year for every ticket that is generated that you respond to. And then Public Service Commission, that is the annual fee that they charge us each year. Then if you move down through there and you go to 5621, I'll just go over this a little bit. The emissions at the power plant, that is a MDE requirement where we have to have employees certified on basically monitoring the smokestacks that come out of the engine so they can tell how much the percentage of NOx is that's being released. They have to go to that class every 6 months, be recertified. Then metering, that's with Caleb and David, and then the relay school, that's also training for David and relays. Next one down is a 40% increase, which is 5622. All that you see there was recommended by Cards Computers. That is to upgrade all the computer software equipment that basically is the firewall system for our computers down inside the substation. And that's recommended by them to be replaced. And then as you move down through there, you'll see 5700, which is basically my desktop. They've recommended that it be replaced with a laptop, which my desktop is out of warranty. That's why Cards has recommended that it be replaced.
Let's stay on page 3 for just a moment. I do want to point out 5625 real estate taxes. You'll notice that in FY21, that was $182,000 at our current tax rate. That was written down by 50% in FY22, the year we're in currently. It's a full phase out, so we're writing that down entirely for FY23. And that does add an additional roughly $182,000 in operating income or available money that can be transferred to cover some of our capital needs within the electric utility. So, and you'll see that also as a revenue item right down in the general fund.
Thank you.
Thank you.
If you go over to, is there any question?
I'm good,
You good?
Yeah, I'm good.
Okay.
Thank you.
All right, if you go to page 4, if you start up at the top, you see the workstation, and then the docking station. That basically is part of the laptop. That's for me. That's part of what Cards is recommending. And then if you go down through there, the next section down, I'm going to talk about the big increase in the contingency, which Natalie, I think I'll let you handle the contingency.
That's basically your difference between the revenues and the expenditures. That will be adjusted as we proceed with the personnel cost.
Okay. All right. As you go through there, there's not much has changed there. Just a little bit in general overhead. That's increased 8% on that. And that's just basically the cost of doing business. Everything is increased. And then I don't know if you want to talk about the next section.
Where you stop? Customer service?
No, the bond issues and customer service reimbursement fund depreciation.
There's debt service for electric fund, the bond principal of $358,000 and bond interest for $114,000. Also, you see there the customer service reimbursement, as I mentioned earlier, the customer service department being spread out by the percent to each utility fund, and portion stays in the general fund. General overhead will be recalculated once we proceed closer to change the numbers, and this amount will change. And there is a reimbursement that being placed for a bond that been transferred on the general fund, I believe about 13 years ago, during the rate study. That's the amount of $10,690 for that 2002 RDA bond. And that's pretty much it.
Thank you. Any questions regarding the electric administration? All right, let's move on to the power plant then. Still on page, actually we'll move to page 5. Power plant, page 5.
Uh, 5200 on page 5. The only increases really there are the cooling tower maintenance. We have maintenance that we have to perform annually on the cooling towers. There's pumps that need to be worked on. They have what's called wafers in them. There's maintenance you have to do on them. Then we have the engine vibration test. That is actually done annually to satisfy the insurance company that insures the engines at the power plant. Basically, they come in, they run the engine and put test probes on it, basically like monitoring your heart. It tells them what the engine is doing, and then next year when they do it again, they look at the difference between the two and they can tell if there's something internally going on with the engine inside it. And then if you go down through there, the general maintenance agreement that, for $6,000, that is the maintenance agreement we have with Carter Machinery. They basically take care of all the maintenance on the new natural gas engine. That engine was around 1.7 million. So I feel, what do you want to say, more confident with them handling the maintenance side of that engine to make sure nothing goes wrong with it. So they take care of that. And then outside contractors, every now and then I got to hire an outside contractor to do specialized work inside the plant on either the relay system or the engines, that type of thing. Relay maintenance, that's something that we have to do manually to maintain the relays that protect the engines, start and stop. And then if you go down through there, if you look under 5251, air compressors, engine oil coolers, those are basically parts for the engines. We have to replace certain parts that go bad on the engines, which some of the engines are built in 1961, so that tells you how old they are, and they take some care sometimes. And then if you go down to capital outlay equipment, you see a 72% increase. I'll talk about these a little bit. The ABB relay cabinet replacement, that is out at Savage Substation. That was actually slated to be replaced last year, but we didn't have the funding to do it, so we kind of painted it and covered it up to keep it from leaking into the relay system. That cabinet is from the 1960s, so that tells you how old it is, and it's due to be replaced. That's $130,000, and then the primary S&C switch, that is to take the place of the big box structure. I don't know if you've looked in the substation down there. It's kind of like a wooden box structure. That structure is basically rotting and falling apart. That's where the generation output comes out of the substation and feeds into from the power plant into the substation. So that's slated to be replaced. And then the substation transformer fans, those are cooling fans that are on the transformers to keep them cool. They were hand-built, I guess you would say, back, I would say probably in the 70s. And the wood structure that holds it up is basically falling apart. Some of the fans have quit operating, they no longer run. So they need to be replaced with the updated system. And then the transformer refurbishing, that is the main project at the substation as far as reliability. That is the first set of transformers as you enter the plant, which was the oldest set. They need to be tested. You do specialized testing, Doble testing, turns ratio, that type of thing. But then you also filter the oil that is in it. So it runs through the filtering system, comes back into it, and it tells them what the transformers are actually doing internally. It's a preventive maintenance. You can catch something before it really goes bad and it becomes very expensive. They're also going to paint them on top of that, replace all the gauges and that type of thing. So basically a major overhaul on the transformers. And then the only other increase on that page major is the utilities for the plant, which that's like everything else. Everything is going up 20-30% on cost.
Now the utilities, we pay that to ourselves on the plant?
I pay a bill, water bill.
Yes, each month has their own accounts now.
Yeah.
That's what I was saying. So is there an ability to do what we did over at the Savage substation with maybe trying to offset some of those utility costs?
Yeah, the main utility cost on the plant are the water side of it.
It's the water side?
Yes.
Okay.
Thank you, Tim.
Hey, he needs all the money.
Hey, I pay him $180,000 at the wastewater plant, so.
Sounds good.
Yeah, he gets some large electric bills.
That's chop tank.
But the treatment plant is, I mean, that's part of doing business. I mean, when we went into it, we talked to Fruitland, Maryland, because their plant is almost identical to ours.
Right.
And they told us to budget roughly $15,000 a month, and that's where
Pretty close. Yeah.
we've been right there.
All right, so let's move on to page 6, I think, for the power plant.
Let me see where we get. Okay, I'll go into 5630, vehicle fuel. You see some increase there, but the big increase is the diesel and natural gas fuel. You see an increase of 51% there, and the reason why is the cost of fuel has basically shot through the ceiling. We have 3 10,000-gallon tanks of diesel fuel down there for the 2 engines, and then we also have the natural gas engine, which is fed underground by the natural gas system.
While we're on that for a moment, I think the main driver of that's probably the diesel more than the natural gas side, right? Because we have a
That's correct.
contract
Yep.
through 2025 for a natural gas service.
That's correct, yes. Now, if we can get those,
What's that?
I would like to think so, contemplate purchasing those other vehicles.
That's why I wanted to make sure we were on the record that
yeah.
we have a contract that hedges that through 2025.
We're working to, at some point to replace 2 of the engines, 2 and 4, with natural gas at some point. We're financially able to do that. So if you move down through there, lube oil for 5638, that's got petroleum products in it, so that's increased also. You'll notice there. If you move down to 5740s, safety supplies and materials, that's increased 200%. That has to do with uniforms, that type of thing, anything that has to do with safety at the power plant. And then also the RPS, purchase power fees, that's basically renewable portfolio standard. We're required by MDE to a certain percentage of our purchase power that we sell has to come from Tier 1 and Tier 2 renewable energy sources, which can be wind, solar, that type of thing. We actually got a reprieve on that with the lobbyist group that helped us out. It would be a whole lot worse than what it is now. And between now and 2025, I believe, we should see close to like a $500,000 reduction in RPS requirements as far as our fees.
Just to put that in perspective for everybody, we talked a moment ago about the taxes that were rolled back under this utility. It was the only utility paying the taxes, and then when you take into consideration the savings with the RPS purchase power fees, the savings of $120,000, just in, I would say, a fiscal year and a half or so with this body, we've grown the ability for the electric fund to be able to spend an additional $302,327 on capital and our capital needs.
Thank you.
Thank you. Any questions in the, oh, do you want to talk about purchase power, or? I think it's implied.
That would be,
Do you want to talk about purchase power, or?
That's pretty much done by our engineering firm. I have no calculations in here. It's the estimated cost for the next year plus the increase in services for development.
Thank you. Any questions regarding our power plant? All right, let's move on to, I think we'll be in page 7, but that's power distribution.
If you don't have any questions on 5200, I really don't see a large increase there. You know, it just has different items that we have to do, like meter calibration. That NextGrid Wi-Fi AMI system that you see, that is the downtown. It started out as a pilot program, but we have kept it around, and it serves about, I think, 96 meters in the downtown area where we read it remotely. And then it also provides the downtown Wi-Fi system where you can sit on a bench downtown and use your Wi-Fi. The underground boring services, every now and then I have to hire an outside contractor to do directional boring for if we have to bore under, let's say, William Street, for example, that type of thing. It doesn't happen too often, but every now and then I have to on that. And then if you go down to, let's say, 5251, you see generator maintenance, meter testing, transformer oil testing. That transformer oil testing, that is an annual test that we do on the transformers at Savage Substation. That basically is a preventive maintenance, tells us what the transformers are doing internally. Then if you go on to 5255, this is a 220% increase in this budget line. And I'll just go from the top down. Electric pole replacements, that's something we do throughout the entire year. In this area, the poles are very susceptible to ground rot because of the moisture in the ground and the weather in general. In this area, it takes a toll on the utility poles. We average anywhere from 8 to 12 poles a year as far as replacing them. That new development S&C switch, that is for a particular development here in town. That's $38,000. That switch will not be ordered until that development starts. And the developer agrees to pay for the switch.
Come on, quick before it's safe.
Developer pays for everything.
You feel the pain.
Hey, Tim, back up for a moment. I don't know if any of the folks have seen it, but some of the poles that we have in town, that sleeve that's been installed on the bottom, you know what I'm talking about?
Yes, what that is, Verizon hired a company called Osmos, and you've probably seen them throughout town here checking at the bottom of all the utility poles. Well, Verizon owns some of the poles in town, and we own some of them, but we kind of share each other's poles as far as the lines that are on them. Well, if they find a potential rotting issue at the base of the pole, they actually put that device on the pole as a support. So it's kind of permanently there. And we have questioned them, you know, about, to me, it aesthetically does not look that good when you look at it. But I don't know how we can control what they do as far as what they install on them and that type of thing, because
How did they determine who had ownership? I assume that took place some time ago.
yes, we know who owns which poles. Normally they're tagged, they'll have Verizon number on it, or they'll have Town of Berlin on it, and that was done many, many years ago.
But I think what I'm trying to ask is, how is it determined who owned which poles?
In town?
Yes, because we have poles that we charge fees for being able to use to
That's
other
correct.
folks. So I'm wondering how some of the poles in town are owned by Verizon and some of them are owned by us.
It depends on where the poles are located, and for example, I'll just pick West Street, for example, okay? Most of the poles on West Street are owned by the Town of Berlin. A lot of the poles that you see on Main Street and William Street, those are owned by Verizon. It just depends on who installed them poles many, many years ago before, some of them are before I was born. So we have them on our maps where we know which ones we own. A lot of times when a pole is bad, we work together with Verizon on replacing that pole. Let's say they own the pole, for example, but our primary is on that pole. We'll come out and work with them, but they supply the pole because it belongs to them. And it normally has a tag on it that they own it.
But is there a royalty rate that they pay us and we pay them for the use of their poles? Or vice versa, or is it a wash, given the?
I think it's a wash, basically. Yeah, and then Comcast, they pay us a.
Right, that's the franchise.
Yeah, that's in the franchise. Okay, and I'll just keep going there. Transclosure 3-phase, basically that's something we do each year. We try to do 2 a year, do those. Transformer 3-phase commercial. Now, a lot of these are going to be, in fact, transformer 3-phase, underground electric service primary, underground electric service secondary. Those are all going to be reimbursed by the developer. Let me give you a good example of cost increases. I actually was working on an estimate today for a development that's going to be going in town here pretty soon. Right now, I'm up to about $90,000. That same development a year and a half ago probably would have been about $45,000. That's how much things have increased. Transformers especially, they went up 50, 60, 70% for the transformer.
Boy, that 3-phase is going up.
Going up.
Yeah.
Just started a year ago.
You should have bought them and kept them stuck. Vehicle maintenance, you see an increase of 114%. What that is there is our bucket trucks, digger derricks that are starting to get age on them. When you get into aerial lift vehicles, cranes, basically, things get very expensive, which Jamie can attest to that, I'm sure, and the cost of things. If you don't have any questions, I'll go on to page 8. The only big increases I see there are in vehicle fuel, 5630, and non-capital equipment, which is 5650. That's 79,000. That's 243%. What that is the cost of single-phase transformers. They fall under what's called non-capital equipment, which most of that is reimbursed by the developer when these transformers go in. Every now and then, we do have to replace some that go bad at our cost. But if it's new going in, they normally are paying the bill for it. Then, if you go down to meters and transformers, that's part of the 79 that you're looking at in the meters. What's going on there with the electric meters is we have certain meters in town that are mandated by the Public Service Commission that they have to be replaced over a certain distance of time. These are the old dial type meters, so every year we try to phase them out and go to a solid state. So any chance we can get to replace them, we take them out of service. The next one down is 5700, that is Augie's desktop. That's slated to be replaced with a new one because the warranty is out on it. Then the next one down is 5730. That's $40,000. That's basically all the materials that are used on the overhead and underground lines that you see out in the field. And then the next one down is safety equipment testing and safety gear. We're required to test our rubber goods that we wear to work on energized lines. That is done every 6 months, and then every year on other equipment. And then the safety gear is our uniforms that the crews wear. They're ATAR retardant, and that's it.
So the 70,000 and the non-capital, that's the carry forward from fiscal 22 that was mentioned, and that's the expense line item. And then the revenue is an advancement from prior year on the revenue side.
Thank you. Any questions regarding the power distribution or anything that we've covered in the electric funds expenditures? All right, if not, we've covered a lot of ground this evening. Any questions that have come to mind regarding either one of those funds? If not,
Are there any, I guess the question I have for you folks, based off what was presented tonight, are there any major changes that we want to discuss at all to what's been presented?
I think that in our little breakout session with water, I had asked Jamie to prioritize some of his capital because we do have the allocation of the ARPA funds for some, but if there's a need to remove or postpone some of those, I'd like to have an idea of what those look like, ranked out by the person that should know it the best, so. But I think that's the only foreseeable change.
I do have a question, if
Go
it's
ahead.
okay. I guess in Jamie's plan, you're going to be replacing Broad Street Pump House, is that one?
I'd love to,
Okay, which is going to require a new electric utility service,
and a new generators 56 weeks out.
right? And then the lift station there down at William and Ocean City, you're going to need a new electric utility
Three-phase.
system. That's going to be costly on the utility side. Can the ARPA money be used to pay for the electric upgrade on the utility side, since that's part of the same project?
That's something we can look at, but I don't know how that works in the scope of ARPA, or if there's some way that we can.
Yeah, because I mean, if not, the electric utility is going to have to eat the cost of providing that.
Well, William Street, the town is funding from our septic callers, it's not using ARPA money.
Okay, but I'm just
Broad
saying
Street.
any of the
The
major
lift station,
projects.
the main project, the full cost will be as the asset to the water fund. So it should be covered, everything inclusive.
So your
Yeah,
services, you would then charge out to the appropriate fund.
Correct. We normally, I'm just sitting here thinking about his projects, and they're going to be total upgrades of the utility side feeding them, which are going to be expensive. And how's that going to be covered?
No, those are good questions, and I think that the two of you need to put your heads together as far as which projects would require
All right,
what types of improvements and whether that's factored into the cost or not,
okay,
and then we can work through them.
all right. Thank you.
Good questions.
Yep, thank you.
All right, I think that concludes our meeting for this evening.
Sorry,
want to
just
say-
want to ask a couple of things before we head out. I guess my thing is, while we are at the work session, I think I want to ask you to have a conversation and discussion, so when we do leave the session, we have a better understanding where we're going with either changing, adjusting, subtracting, adding things. So then I can be prepared to present you with the next report, the next step for your discussion. And also that would help everybody to understand what exactly we're talking about. I haven't seen that in the general session, and I don't have a good feel for the utility session, leaving the room today, going back to my office tomorrow, where we stand, what adjustments do we need to make, what we need to work on for the next couple of weeks before we go to introduction. So I
would say-
guess a more involvement and discussion during, because that's the set work session, we've got to be open for conversations.
And I would say one of the things that I think we need to adjust for, the things that are on the top of my mind, is I would allocate that same amount that we have in the general fund for salaries. I think the placeholder is 5% at this moment. Across each one of the funds, I would add the $1 million for the ARPA that's already been allocated for the smart meter project. And then I would say adjust and bring current our healthcare numbers to reflect the presentation that we have this evening. I think that's a pretty good start. Outside of that, I would really like to see the prioritization of some of the capital projects.
So you're suggesting only $1 million to the smart meters,
Well,
not the
that's
$1 million to
And we got
the
Broad
lift
Street.
station?
Yeah.
Well, I think that what I would like to see is the $1 million placed in for the money that's already been approved through ARPA. And then I want us to put our heads together one final time now that we have an idea of what those project requests are and the council decided on some of their ideas for the ARPA funding. I want us to revisit that, and then we can start to put it in the budget before out.
I can start to revisit right now. I've sent my email out and said 1.3 for the water fund, 1 million for the lift station, and the balance of it goes towards the upgrade of the sewer plant. I think it's all gone now.
So that's where my mind stands right at this moment.
So I guess I wanted to go back to the Broad Street cost and Tim's questioning. With the Broad Street cost or the total number that was presented, did that include the upgrade with electric, or is electric going to be something we add?
That would be separate.
That's what I was curious.
That's an engineer's cost estimate of, just for the lift station and what's associated from the meter into there.
Right.
Not the hookup.
I think we need to look at those costs holistically so that we can understand what they are. All right, Councilmember Burrell, I think you had a question.
No, I had a comment.
Okay.
You know, as a resident of the town of Berlin, I go to my light switch and hit it, the lights come on. I go to my faucet and the water comes on. It is my most sincere wish this evening that these presentations were viewed by the public.
Yes.
I think it is important for us to understand what goes into hitting that light switch or turning on that water faucet.
Better yet, Mr. Burrell, or flushing that toilet, because that's the one.
Or flushing the toilet. But as a resident of the town of Berlin, I am a recipient of those services. And I wonder how much thought goes into what actually has to happen to make that happen. And these two guys do a fantastic job. Thank you for the job you do for the town of Berlin and the citizens.
I'm probably gonna speak for Tim too. I know I do a lot for the water resources, but we have a very good group of employees down there.
We did.
I know Tim's guys do. I'm gonna say it in general. I work with water resources, electric, and public works, and the staff up here. Everybody works for the town of Berlin. So it's a good place to come to work, and we work together. Tim always calls me if I need help. I call him. There's very little, we don't argue about it. We just go get our jobs done. And, you know, if he needs help flagging so he can get electric back onto somebody, he knows to call me. If I need a pump pulled, I know to call Tim. So, I mean, we have a very good internal working relation. And I will say I enjoy coming to work. Tim lives and breathes electric. I mean, I live and breathe the water and wastewater side. I mean, I love messing with the crack. But, I mean, it's, you know, but I appreciate you all for listening to us tonight. The stuff that we've explained is not a wish list. It's truly something we definitely need. I mean, we've cut for so many years, and there's just, I don't know what else we can cut. I mean, and that's what, we've cut for so many years, and, you know, sooner or later, there's no cutting left. I mean, you got to put something back so we can keep up with times. I mean, you look at other towns, they do a street here and there. I've been here 20 years, and we've done 4 streets in 20 years, and it's showing. We need streets done. We need upgrades of sewers done, water done. I mean, I'm not, you know, I'm not trying to get on the high horse, but I appreciate everything you do for us now. But we do need to keep our plan together to advance.
And when you say streets, I think it's important because people see streets and they see asphalt. I think it's important to understand that when you say the streets, you're talking about the underlying infrastructure below the road.
And the underlying infrastructure below the road is where the money is. I mean, for every foot you're in the ground, it's money. So the shallower the street is, the cheaper it's going to cost. The deeper the street is, And there's lift stations that people ride over every day that don't even know there's lift stations. There's 2 lift stations I know people ride across every day that they don't even have a clue they're lift stations. I mean, it's just, you know, I do care for the town, and I want to be prosperous, and, you know, I enjoy working here.
Thank you. We enjoy the work and respect and honor the work that you, all of you do.
Sir, concur with that, when you say that Jamie needs to go back and prioritize his needs and equipment that is placed in the capital projects right now. With that said, if we're allocating $1 million from ARPA to cover the smart metering, we're still gonna leave 1.3 as a deficit. So I don't think Jamie can prioritize and cut 1.3 somewhere to cover the deficit if the ARPA or discussion for that is not standing. So I don't want to go to introduction, and we're going to stay there in introduction meeting, guessing what we're going to do with the gaps.
Well, technically, we can't do that. So a budget has to be introduced in its balance, so it can't
Correct,
be.
so that's why I'm asking for instructions going from today. Is it going to be another meeting, are we going to discuss and get
We are going to have
together?
another discussion about the allocation of ARPA funds.
I mean, to balance that utility out, can't we just allocate the 1.3 now?
I think that it, well, no, you can't do anything in a work session
Right,
technically,
right.
but I think that
For
we need to
budget
have
purposes.
no, I mean, I think that we need to have a holistic conversation about what's going to come from ARPA as a whole, as it's impacted from the general fund to the utilities, right across the board. And there is time to make that change and then meet the introduction deadline. So I think we'll be okay. But it's another conversation that we do need to have.
Well, wouldn't that be just next meeting then?
It's not far down the road at all.
You're introducing your budget on the 9th,
It
right?
has to be introduced on the 9th. So,
Well, we have regular meeting session on the 25th.
Correct.
It's not
Yeah, that's
for
what-
the budget discussion. You can certainly discuss ARPA
That's
as the agenda
that's what
item.
we were just talking
Yeah, that's
about.
that's what I was referring to, is the ARPA funds.
Should I plan to add that to the next,
The-
just as ARPA discussion?
Yes, an ARPA discussion, but it's going to be holistic. But we need to have a conversation about what that looks like in the general fund across everything, so. All right. I think you're up.
Oh, move to adjourn.
Oh,